Welcome to Industry Focus. Today is Wednesday, March 24th, and I'm your host, Emily Flippen. Today I'm joined by Fool.com's so salty superstar sultan of substandard snoring securities, Brian Feroldi, in case you couldn't infer that from the wonderful title. And we're going to be talking about three businesses that are tackling the really interesting and exciting industry that is sleep apnea. Brian, Mr. Sultan himself, thank you for joining.
I am happy to bringing back to turn Wildcard Wednesday back into Healthcare Wednesday, Emily.
I really think we should be trying to make a more concerted effort to cover healthcare companies. Although I will admit, you brought this idea to me, which of course I greatly appreciate because it's not an industry that I know super well. And it could be challenging, I think, to jump into the healthcare space because it does feel like it has a higher kind of hurdle for understanding. So A, I really appreciate the knowledge that you're going to be bringing today with these companies and this industry. But B, man, did it stir up some emotion in me. And I'm going to do my best to not let my personal feelings about the sleep apnea industry start to make their way into the podcast. And if I do, maybe I'll bring them in at the end of the show. So, prudent listeners can just skip over that section if they so desire. But it was really fun and interesting to try to learn about this industry over the past week or so. So A, thank you so much. And B, let's jump into it.
Yeah. And when we talk about medical device companies and healthcare companies, sometimes we're talking about really small diseases that are only affect a very small subset of the population. Every now and then we talk about something that's extremely popular and extremely prevalent. When it comes to obstructive sleep apnea, this is an incredibly common medical diagnoses as we're going to get into. So I would wager a bet that pretty much everybody listening to this has sleep apnea or knows somebody with sleep apnea.
Yeah, it's actually really interesting. So when we started to prep for this show, you said, I'll take care of the companies because obviously those are the businesses that you know so well. If you could just do some research about sleep apnea. And when I was pulling in this research, the variation in the numbers of expected cases was so wide. We have it on the low end from the World Health Organization, who I believe back in 2007 estimated that there are around 100 million people in the world who suffered from obstructive sleep apnea, that's OSA. But even they acknowledged, hey, this is probably a flawed analysis because the issue is so underdiagnosed and under-researched. And more of the recent research, probably more viable research, but also more biased research, comes from the companies that we're going to talk about today. So the businesses that are trying to treat sleep apnea, and they've put a lot of money into research to treat sleep apnea. And the estimates now are closer to, say, 1 billion cases worldwide of obstructive sleep apnea, around half of which they estimate are mild to severe cases that would need some form of treatment. So it's a widely, increasingly known issue.
Yes, it's an incredibly common, and to your point, it's hard to put an exact number on this. And one of the big reasons why is that sleep apnea is very, very underdiagnosed. I mean, I've seen estimates that say as many as 80% of people that actually have sleep apnea on some form, it could be extremely mild, it could be severe, are not yet diagnosed. And that's because you don't know if you have it. I mean, you have to have somebody, if you are sleeping through the disease when the disease is most prevalent, it's really hard to tell. There is a telltale sign that people know if somebody in their house has sleep apnea or may be at risk for it, and that is snoring. One of the things that sleep apnea is the upper airway is malformed, or there is some part of the airway that gets blocked overnight. And that causes the person to stop breathing for anywhere from a second to, as much as 30 seconds. If you're not breathing, you're not getting oxygen. And that just can't be good for you over time. There's a lot of side effects or symptoms of sleep apnea. There are some obvious ones like snoring. As we said, you wake up, you don't feel fully refreshed. You have a lack of energy. Maybe you have an increased risk of getting a headache or having depression. But longer term, there are some actually huge comorbidities to having sleep apnea. People with sleep apnea are at 2x the risk of having a stroke, 2x the risk of having a cardiac disease. So if you have sleep apnea, you really want to get diagnosed and you want to get treated.
It's interesting because if you go back, say back to that 2007 research from the World Health Organization, a lot of the aspects that doctors and providers were looking for in determining sleep apnea was the effects that it was having on people after they woke up. So one of the biggest telltale signs was actually people getting in car accidents because they were so tired. And increasingly, I think providers are becoming aware of how to address these issues earlier on when the person is experiencing them as they sleep. So again, to your point, things like headaches, snoring, just a general lack of energy. But the big thing is, as you mentioned, since the disease is the tightening, the restriction of the airways, it's gasping. So people whose blood oxygen is actually decreasing to a dangerous level during the night because they're not able to get enough oxygen to their body. I'm a little skeptical when we talk about the comorbidities because one of the biggest risk factors for determining sleep apnea is actually obesity and aging. And both of those things are both associated with some of the comorbidities that you mentioned that go alongside sleep apnea. But I think if there's one thing that everybody can acknowledge is we're an increasingly aging population and we're an increasingly unhealthy population. So I don't think there's a good argument to say that sleep apnea is going away anytime soon.
How about this alone? If you have sleep apnea, you are probably likely to be a snorer. If you are a snorer, your partner is probably not very happy with you. So that alone is a reason to get diagnosed and treated.
No doubt about that. But I'm gonna put out some data about how it is in the U.S. before we move on to our first and largest company that's looking to treat sleep apnea. If you just look in the U.S. alone, over the last year, the direct and indirect costs of sleep apnea in the US were around $150 billion. So it's a pretty substantial industry that's getting an increasing amount of attention. And the businesses we're going to talk about today are pretty small in comparison to what you would consider the market opportunity, especially when you consider that that's just looking at the United States and this is a worldwide issue.
Yeah, I think that number really underscores that number is enormous, right? And that's mostly due to indirect costs, meaning that loss of productivity and that kind of thing. But yes, treating sleep apnea is a big business. This is a multi-billion-dollar global industry. There are numerous treatments for it. We're going to get into 3 companies that provide them. And I think just on the basis alone of 1, the industry is huge, and 2, it's going to become more and more common to diagnose sleep apnea over time. This is an industry that investors should take a look at.
So, with that being said, what's the first company that you think investors should be aware of when looking at sleep apnea? I think most people listening right now are probably familiar with it.
Yeah, so this company is called ResMed. The ticker symbol there is RMD. This is the biggest of the 3, and we're kind of going based on risk level. So this is the lowest risk of the 3. So ResMed is the pioneer of the gold standard for obstructive sleep apnea treatment. It's called continuous positive airway pressure, or CPAP devices. These are devices that are put next to the patient while they sleep, and they have a tube and a mask that goes on with them. And the patient wears the mask all night long, and the device constantly pumps a stream of high-pressure air into the throat. That high-pressure air keeps the person's throat and airway open all night long, so that way they get the oxygen they need, and it prevents the muscles inside from relaxing. Now, ResMed has been a phenomenally successful company over the years. It has grown like clockwork and has provided investors with gigantic returns since it came public in the late 90s. One of the reasons why is that this business is a razor and blade business. They sell you the CPAP pumps themselves. That's a durable good that can last for, a couple of years. But the company also makes money off of the supplies, and those would be like tubes, the masks, accessories that go along with them. So that, when combined with a growing area of revenue for the company, which is software that is used to both diagnose sleep apnea as well as connect patients and providers with data, ResMed has been a really fantastic business.
It's so ubiquitous that when you reached out to me about wanting to cover sleep apnea, I wasn't aware that there was a treatment for sleep apnea that wasn't a CPAP machine. I mean, that's what a corner I think ResMed has had on the sleep apnea market. It's the immediate go-to solution for anybody who is experiencing these symptoms of sleep apnea. And I think that that has definitely shown up in its results. And what's worth mentioning is as yeah, at the start of the podcast, we said it was a $150 billion a year industry just in the United States. ResMed is less than a $30 billion market right now in terms of market cap. So it's pretty small in relationship to the market opportunity.
Yep. And now the company has been selling devices for almost 40 years now, so it is a relatively mature business. It is still producing growth, especially in international markets. And as I said, it's getting into the software business. It's made a couple of acquisitions in that space to further diversify its business. But the company puts up very steady, very predictable growth. In the most recent quarter, we saw revenue growth of 9%. This is a company that produces a gross margin of almost 60%, and it's producing net income. Last quarter, its net income grew 25% and its earnings per share grew 17%. This is such a stable, mature, and predictable business that about 8 years ago, they started paying a dividend, and they have raised that dividend ever since. But this is the gold standard of obstructive sleep apnea. And as I said before, if you bought this stock at the day of the IPO in the mid-1990s, you are currently up 32,790%. Wow.
And it's by far the safest play that we're going to be talking about in the sleep apnea industry, because I know that our next two companies are much smaller, much more growthy, but also have much higher risk as a result.
Yes, totally. So if you want the safe, secure, lower risk, steady Eddie grower, ResMed is definitely the choice of the three. And again, the ticker symbol there is RMD. A little bit pricey today. It is trading at about 44 times earnings, and its dividend yield is only 0.8%. But I think that the market is paying a premium for the stock given its consistent growth. Now let's talk about a higher growth company, Emily.
Also, I love the fact that 44 times earnings, you're like, it's a little pricey. In this market, I'm like, wow, there's earnings.
You said earnings,
less
right?
Than 50. Yeah, it's downright cheap at this market. But yes, let's talk about our second company.
Sure. So the second company is called Inspire Medical. The ticker symbol there is INSP. This company is an order of magnitude smaller than ResMed. It's about a $5.6 billion company. This company was actually started inside the medical device giant Medtronic, and it was actually spun out in 2007. The idea was, again, focused on sleep apnea, but there's a little secret about people with sleep apnea. About at least one third of people that are prescribed CPAP therapy, they end up abandoning the treatment. And that Inspire estimates that number goes as high as 60% in some cases. People that have CPAP machines might not necessarily like them. You can have discomfort from wearing the mask. You can get nasal congestion from wearing it. There's usually a small noise that happens with the machines themselves, and those are unattractive to a lot of people, and you can't get comfortable while they're sleeping with them. So Inspire took a brand new approach to treating obstructive sleep apnea. They created an implantable neurostimulator device that is inserted into the patient's body during a minor outpatient procedure. What happens is a mild stimulator gets attached to the patient's hypoglossal nerve, which is the nerve that controls the airway, tongue, and the muscles. And when the device is turned on, it detects when a blockage is in the airway. If a blockage is detected, it gives a small electrical signal to that nerve, and that stimulates the muscles to open up and for the airway to be open. What's nice for the patient is once this device is installed, it's turned on and off remotely, and there's no need to use a CPAP machine. The stimulation is so small that patients sleep right through it. So it essentially keeps the patient's airways open all night long without having to use CPAP.
And what's worth mentioning about the markets for Inspire and ResMed, and the reason why I think both of these companies can succeed at the same time, is that you actually have to qualify to be a patient for Inspire Medical. So not every person who suffers from mild or even moderate sleep apnea will qualify for the surgery offered by Inspire Medical. It's really aimed at those with higher, moderate to severe issues related to sleep apnea. So you go through a process of evaluation to determine if you need the surgery. And it does have to do with the fact that one is selling you a machine that you use at night, and the other one is quite literally putting you under the knife. But to your point, Brian, Inspire Medical surgery, it's a relatively simple procedure. So I think a lot of people may hear that it's surgery and may think to themselves that there's a natural barrier or a lack of desire from patients to have this solution. But I think if you're somebody who is actively suffering from the effects of sleep apnea, and for many people, especially those with moderate to severe sleep apnea, it keeps them up every single night. It wakes them up in the middle of the night. They're not able to get a good night's sleep. They want something that can permanently fix their problem. And I think Inspire Medical, especially when compared to the CPAP machine, which can be uncomfortable, does have maybe a more niche but also exciting aspect of the market that allows both of these businesses to succeed.
Yes, totally. There are definitely some downsides to Inspire. Or to your point, you do have to try CPAP first. You do have to fail on that. You typically have to have a more severe version of sleep apnea, and the device itself requires surgery and costs much, much more. It's tens of thousands of dollars to get this device installed. But even with all those caveats in place, it's very clear that the market demand for Inspire system is very high. So this company, first off, they are in the scale-up phase. So they are really focused on commercialization right now. And they've done a great job with there. The company has 220 million lives under coverage in the United States. That includes Medicare. So they've done a really great job to get coverage for this thing. And the company's most recent results clearly show that it is having an impact on the market. Last quarter, revenue for this company grew 71% to $46 million. The vast majority of that is in the United States, but this company already is in international markets and is selling in Europe. 90% of sales are in the US, but I like seeing that they are already having some success in Europe too. The gross margin here is very impressive. 85% for the company. And while they are losing money, the net loss is negligible. Last quarter, the net loss was $8 million, and this is a company with over $230 million in cash on hand. They have been a hyper growth stock since they came public. The stock was up over 700% since their 2018 IPO. Given the growth rate and the potential of this business, I understand why Wall Street is so excited.
I don't think it occurred to me until you just mentioned that they have Medicare coverage. I don't think it occurred to me what a big component that is for sleep apnea, because at the offset, we mentioned that one of the biggest risk factors for sleep apnea was actually age. It's associated with an aging population. So having Medicare coverage, I didn't realize, and this is such a cutting edge technology, that to me is a really compelling aspect of this business.
Yes, and with any medical device, insurance coverage is key. You can come out with the greatest thing in the world, but if insurers won't pay for it, you're going to have a heck of a time commercializing it. So it's really great to see that essentially since this company came public, it has consistently won over insurance companies and gotten more and more lives covered.
Although, to the point you made about valuation on ResMed, this is not a business that has any right? Has no earnings to speak of here. So I think investors, if they're interested in Inspire, which it's definitely an interesting business, it's certainly an interesting technology, you are paying up for that.
This is a company that is currently trading at 46 times sales, not earnings like we said before. So yeah, Wall Street is really on to this growth story and they have bid it up appropriately. But if the company can maintain its growth rate, and again, this is a company with an 84% gross margin and rising, fast growth margin deserves a high valuation.
And the last stock we're going to talk about today for the sleep apnea industry is our by far smallest business. And I have to give the caveat before we talk about this business. It's super cool, but it's super spicy. I like that word. It's a good description of what this business is doing, but because it is so new and it is so small, it's worth noting this is a sub $200 million company. So it's not nearly as liquid. It's not nearly as proven as the other two businesses we talked about. I think it would be silly to have a conversation about sleep apnea and not mention this company because their technology is so unique. And again, Brian, when you brought it to the drawing board, you sent me down a rabbit hole researching this technology, and I love it. So it's definitely worth talking about. But I want to add the caveat for all of our listeners that while we do spend a lot of time talking about larger businesses that are more liquid as to not potentially expose investors to unnecessary risk, this is a very, very risky business, but also a very, very cool business doing exciting things in sleep apnea. So we did want to talk about it.
Yes, I'm glad this cleared the legal team here, because this is a super interesting business, and one that I first heard about from one of our listeners on Fool Live. They said, "Hey, have you ever heard of this company?" And I said, "No," checked it out, and just like you just said, Emily, when I first looked over it, I was like, "Wow, there's a interesting angle here." So both companies that we've talked about thus far, ResMed and Inspire, they are focused on treating the symptoms of obstructive sleep apnea. One through CPAP technology, the other one through a implantable neurostimulator. This company, Vivos Therapeutics, ticker symbol VVOS, they are focused on curing what causes sleep apnea in the first place. The simplest way of describing this technology is that it's a 3-dimensional braces system. So it is a device that is custom to your mouth, worn in the face, and it works very similar way to braces. There's a series of screws that are in this device, and when you wear this device for 12 to 16 hours per day, it slowly transforms the shape and outlook of your upper airway over time. And it molds your upper airway to gradually make it easier for you to breathe at night. And the company actually has clinical data that shows that people that use this device end up breathing easier, and in some cases, their obstructive sleep apnea actually becomes cured.
Okay, so I understand this business from what you've just said. It's almost like Invisalign, but instead of trying to fix your teeth, it's trying to fix your airways. The thing that I don't understand is why, in preparation for this podcast, you felt the need to include a photo of their devices in our outline, because I wish I could share screens with all the people listening to this podcast right now, but these things look like torture devices. I'll tell you what, if I was a patient, there's no way I'm putting this thing in my mouth.
Yeah, if you've ever seen a retainer, if you've ever had a retainer, the old school retainers that go in your mouth, it's like that, but uglier. And it kind of makes sense that it needs to be, right? Invisalign is just designed to move the shape of your teeth. In this case, this device is designed to change the shape of your upper mouth and airway. So it needs to be able to put constant pressure on there. So yes, this design is not going to win any beauty awards. However, if this can cure your obstructive sleep apnea, I can see it being pretty popular.
I agree. And in defense of Vivos, this is a product that I think more consumers may be willing to try, just because we're accustomed to putting things in our mouth a little bit more than maybe we should be. I think all the different dentistries have become pretty good about selling people on the health impacts, especially of having things like retainers or small adjustments over time. So the concept itself is probably pretty easy to sell to people who are suffering with sleep apnea. And I like the aspect that you wear it for, I think you said 12 to 16 hours a day in the early evening and then over the course of your night. And it's not obtrusive enough that you're unable to drink, swallow, breathe. You can talk. You might have a little difficulty, but you can talk through wearing it. So all of those things, despite how ugly and aggressive it may appear, doesn't seem to put you out that much as a user.
Yeah, to your points. Again, this is a removable device, so it's not like braces that it's in and then you wear it for 2 years. This is a device that the user puts in and out, so you can drink with it, you can breathe with it, you can talk with it. You just can't eat with it. What I found fascinating about this technology is, first off, it's not experimental. This device is already out there in the market. It's already FDA approved, and over 15,000 patients worldwide have already been treated on it. What I find the most fascinating about this business is their business model. So they are attempting, their business model is to drive patient interest through this device through dentist offices. So they already have 1,200 dentists in the United States that are trained on using this device, and they sell it through the dentist offices. So if you are a dental practice and you want to offer this treatment to your patients, you partner with Vivos. You actually have to pay Vivos a multi-$1,000 fee to get set up in this practice. I've been researching medical device companies for a long time. It's extremely rare that a company goes out and says, "Oh, you want to sell our device? You have to pay us a fee to get up and running on it." And so far, 1,200 dentists have been willing to do that. So that is really impressive. So that is one of the company's revenue sources right now. Again, because this technology is relatively new, is they get paid an average of $28,000 by a dentist practice to get set up. The second way that they make money is by selling the actual systems themselves. So they receive a revenue of about $1,600 per adult, or about $400 for a kid, and the dentist typically charges their patients about $9,000 on top of that. So the reason that dentists are willing to pay this company to offer it is it becomes a revenue source for the dental practices. The third way that this company makes money is they've developed their own billing system that helps with training and helps to get this through insurance companies. That's a recurring revenue source for this company. Now, in all three cases, we're not talking about a lot of revenue here. The company's revenue through the first 9 months of 2020, that's all the data we have because this is a relatively new IPO. For a 9-month period, this company's revenue was less than $10 million. So it is very much still in the scale-up phase. However, those three revenue sources that we talked about are pretty high margin. This company's gross margin already is 79%. And I think that there's room for that number to grow.
What I think is really interesting, and I didn't expect when looking at this business, Vivos, was how cheap that system is. And it's FDA approved, how cheap this system is in comparison to the alternatives already on the market. My impression was new technology, especially cutting edge technology, right? It tends to be more expensive. We saw the scale up in the comparison between ResMed and the name is Inspire. Yeah, between ResMed and Inspire, the jump in the cost, I mean, we're talking $5,000-$10,000 difference. But the actual process for Vivos, I mean, it's a system that costs, I think you said $1,500-$2,000 for an adult. So readily affordable in a way that I didn't quite expect.
So the revenue to Vivos will be that much money. The actual price that the dentist practice charge is closer to $9,000. But yeah, keeping the scale of costs is actually important here. So if you want to go,
I take it all back.
If you want to go on a CPAP machine, the cost to get started on that is about $2,500, and then there are also all those consumable fees for the rest of your life. Not to mention the fact that CPAP doesn't cure anything, it just treats the symptoms. To go for Inspire's device, which again is you've failed or you've gone off CPAP machine, it doesn't work for you and you're going through a surgery, the total cost of the Inspire system is about $30,000 to $40,000, depending on where you are in the country, because again, there is a surgical component to that. And again, that doesn't cure your obstructive sleep apnea, it just treats it in a less intrusive way. By comparison, Vivos at $9,000 does sound expensive, but if it can take you from having sleep apnea to not having sleep apnea, I don't think that's all that expensive. I mean, aren't braces like $3,000 or $4,000?
Yeah, I believe so. And every single time I go to the dentist, I am constantly being told that I need to get Invisalign, even though my teeth, well, admittedly, maybe a little bit crooked, are perfectly fine. And I think the Invisalign out-of-pocket cost is something similar to that I could expect from getting braces. So think about how much dentists love to push stuff that can make them money. I think if Vivos is approaching dentists and saying, hey, this is something that you can, again, upsell your existing customers, it helps improve their life. And, even if it costs them $9,000, generates around $1,500, $1,600 in revenue for Vivos, it's a pretty compelling business, even if I was slightly wrong on the total costs.
That's okay. You do have to keep that costs do matter. I mean, certainly. And of course, those are the list price we're talking about, the prices that patients actually pay. There's a bazillion things that goes into that. But I think keeping the scale of each is mind. It's also worth saying that Vivos is not designed to treat the most severe cases of obstructive sleep apnea. It is mostly designed around people that have the mild to moderate. And it doesn't work in every case. Some people still have to go on CPAP afterward, but they do have clinical data that shows that your sleep apnea typically does improve. Some people never have it again. Other people, the severity of it declines. But either way, I think that Vivos is a pretty compelling idea.
Completely agreed.
One other thing that's worth noting here. While the company just did come public, it is still losing money. Its net loss for the first 9 months of 2020 was about $6 million. We should actually get more up-to-date information on this company tomorrow when it reports, and that will be its first earnings report as a public company. One thing that I think is an interesting thing to note is that Mark Zuckerberg, yes, Mark Zuckerberg, his dad is a dentist. And he is actually on Vivos' board of directors. So that's an interesting thing to note.
And actually really compelling for the dentistry angle of Vivos. I think that is what maybe sets this offering apart from the other companies that we talked about today.
Yes, totally. All right, but Emily, we pitched 3 companies here, a low-risk one, a high-risk one, and a super high-risk one. Which ones interest you the most?
Well, what I will say is I think there's different value provided by each of these businesses. And I think depending on what type of investor you are, whether you're more focused on growth or dividends, in the case of ResMed, you can probably make yourself a pretty compelling basket with any number of these companies. But, and this is maybe where I go off on a little bit of a tangent, and I apologize in advance, I think the sleep apnea industry in general kind of worries me a little bit, especially as it applies to ResMed, because of how they sell the products through these sleep centers, whose sole purpose it is to diagnose people with sleep apnea and get them to buy CPAP machines, when in reality, a lot of those people may be struggling with other issues that affect their sleep. And the failure rate with CPAPs are so high because they're so uncomfortable. I think those things make me a little bit skeptical of ResMed. Not that it's a bad business, but out of the 3, I'm not sure if it's the one that I personally would want to own. I actually think I lean towards Inspire. It's maybe a safer play than Vivos. Vivos is super interesting, but it's a little edgier. It's a little smaller than companies that I typically buy. I really appreciate the technology that I think Inspire has created. I mean, the idea that we're talking about a machine you can insert in your body that sends your brain waves signals to open your throat, that concept is just so amazing to me. I have a lot of respect for the technology, and I appreciate the fact that you have to qualify to have the surgery, so they're not potentially over-treating people the way that people can be over-treated in these so-called sleep clinics that we see jumping across the country. So for that reason, and without going off on too much of a tangent there, I think Inspire is the one that, if I had to choose between the 3, would jump out to me the most. But Vivos is also very, very interesting.
Yeah, I'm right there with you. I think that Inspire is probably the most interesting of these 3 picks. It clearly has proven product market fit. It is run by a founder-led management team. It was spun out of Medtronic, so it has that technology back to it. You are paying through the nose to get your hands on shares, but I understand the interest in there. Although I think if I had to pick, I might go with Vivos. It's definitely the smallest, it's definitely the spiciest, but I really like the idea that the company is, 1, selling through dental offices. I think that will give it an edge to have a dentist essentially become the sales force. And 2, I like the fact that they are actually curing it. Now, I think that the market is so big and that all 3 of these companies, there's plenty of room for all 3 of them to grow and prosper. But if I had to pick, I think I'm going with Vivos.
I love that. And again, I can't wait to see what happens with Vivos. It is such an interesting business. I had no clue it even existed until you brought it to today's conversation. So I appreciate all the diligent research you have done to make this conversation possible.
Anytime. I always love talking about medtech, especially high growth ones.
We'll have you on more often. We need to bring back medical or healthcare Wildcard Wednesdays to be a more frequent thing. So I'm all ears anytime you want to talk.
You'll be the first to get pitches then, Emily.
Listeners, that does it for this episode of Industry Focus. If you have any questions or just want to reach out to say hi, you can always shoot us an email at industryfocus@fool.com or tweet at us at MFIndustryFocus. As always, people on the program may own companies discussed on the show, and the Motley Fool may have formal recommendations for or against any stocks mentioned, so don't buy or sell anything based solely on what you hear. Thanks to Tim Sparks for his work behind the screen today. For Brian Feroldi, I'm Emily Flippen. Thanks for listening and Fool on!